Actually, the thing is, in India, if you want to take admission in medicine, definitely every year, 100,000 or 200,000, like that type of students are giving examination. So
Wow.
the number,
And they will
the
take
board
only
exam, yeah.
150. Hi lovelies, welcome back to my YouTube channel. My name is Adi and I am an incoming third year medical student currently studying in the Philippines. So basically I create content about my life experiences as a medical student and also about my experiences as a foreign student studying and living in the Philippines. So if you're a returning subscriber, thank you so much for your support. I am so grateful. And if you have not subscribed yet, please consider subscribing to our channel. So in today's interview, in the comment section a couple of weeks ago, I actually have one of my subscribers who actually brought to my notice, not literally bringing to my notice anyways, he mentioned that it would be nice we get an Indian student on the channel. And so I remember I have someone I know from my school, and yeah, so today we'll be having him on our channel and I'll just let him introduce himself.
So I'm Ankur from India. I started my journey for medicine from 2017, and I finished my BS Bio in early year. So there was a conflict between the two schools. So because of that, I was holding my medicine for I think 1.5 years because of that case was under international court.
Okay.
So because lots of international students were affected, and since we are foreign student, we have to follow the two countries rule and regulation, especially our country's rule, Indian rule, and also you have to follow the Philippines rule.
Okay.
So if you will combine these two rules,
Okay.
and there is a conflict between two schools, you cannot really take yourself out from the school, because as according to Indian rule, you cannot transfer to another university.
Oh,
So you have to continue
in
and
that particular
you have to-
university.
Yeah,
Oh, okay.
it was before.
Okay.
Then we informed to since there was a conflict, so we cannot do anything, and we have to approach Indian Embassy regarding this concern. So we informed the Indian Embassy. Indian Embassy gave advice that don't enroll in that two particular university for temporarily. Temporarily, and then we transferred to another school for just 1 year or something. Then we passed there in another university, but then suddenly both of school received approval from the chat.
Okay.
So we have to come back.
Okay.
So we came back to our main university where we finish our BS Bio,
Okay.
means pre-med course.
So how long did it take exactly
It
for your
took,
pre-med?
Pre-med, it was 1.5 years.
Okay, for you too?
Actually, yeah, because it was our school was high school plus. It was K to 12, so it is high school and senior high. So it was like until 12th standard.
Okay.
So in that we have biology, mathematics, all this kind of subject, music, physical therapy. This all subject included during our school time.
Okay.
So you don't have to repeat that subject; it will be credited.
Okay, so it took you like 1 year and 6 months to
Yeah,
finally
to
complete
finally
the
complete the all
pre-med.
other subject which was remaining.
What part of Asia is India located?
It is South Asia.
South Asia,
Yeah.
and Philippines is in the southeast of Asia.
Yeah.
Okay, so what part of India are you from?
I'm in part of West India, western part of the India,
Okay.
from the Gujarat.
Gudra.
Yeah.
Do you guys have?
which is nearby Mumbai actually.
Okay.
Maharashtra,
I've heard of Mumbai. Do you guys have like a specific language you speak?
We speak Gujarati language. Actually, in India, there are a lot of languages.
For your own language,
Yeah.
what do you guys speak?
For my mother tongue, I speak Gujarati.
How do you say good day, good morning, or just say like greeting my subscribers in your language?
So, if you want to say good morning, then
Yeah.
you will say Suprabhat.
Okay, so
But
Suprabha.
yeah, but the thing is, we mix up the English word
Okay.
with our language. So, for example, if you will use good morning, we usually use good morning in India also.
Okay. In my first year, in our school we are being grouped into sections. So the section I belong to in my first year, about 90% of my classmates were Indians. Literally, I'm being honest. Like 90% of the people in my sections were Indians. So it got me wondering, like, why are there so many Indian medical students in the Philippines?
The thing is, in India, we have a specific criteria and specific like number of the seats available for the medicine. In India, there is a rule that per university there are 150 students.
For the medical school?
Yeah.
Only
So,
150.
150 students
Wow.
per year in, like, only first year 150 student can enroll.
Oh wow.
So that is making sense that there will be no rush or demand, like there will be no rush in the school. So even doctors can take care of the student and can pay attention a lot.
Okay, so you're saying that like I think like the capacity for each university
it is
per year is
150.
only 150.
Yeah.
Wow.
And not, I think, I don't know for private universities,
But the government wants
150
150.
fix.
Wow. And probably maybe going to the private universities will be more expensive. Is it cheaper
It is
in the public in the
it
government
is
universities?
expensive. It is expensive.
Oh, okay.
Actually, the thing is, in India, if you want to take admission in medicine, definitely every year 100,000 or 200,000, like that type of students are giving examination. So
Wow.
the number,
And they will
the
take
board exam,
only
yeah.
150.
So as for like past visit, I remember when I was in India 7 years ago. That time it was 45,000 in my state only. So it was like 45,000 student only can enroll in medicine.
45,000?
So, yeah, 45,000 student can enroll in my state only, in Gujarat. For other state, I really don't remember how many student can enroll.
Okay.
So when the result is coming out,
Okay.
there is a reservation quota for lower caste.
Okay.
There is a caste system for the reservation.
Okay.
That is really affecting students, those who are in general category and higher caste. So for example, if I have to enroll, I'm in general category, so I need a higher percentage. So for example, in board exam, for general category, cutoff will be 78 plus, 80 plus, like that. So it is depends on the result, how the result is made, how many student pass, like that.
Okay.
Those who are lower category, like lower caste, like it is casteism is.
When you mean caste, like is it like an area like from? What do you mean by lower caste? Sorry.
Actually, there are different type of the caste. It is from the past. Actually, it is started from beginning of our freedom. Before from we got freedom, because during that time particular work was assigned to particular caste,
Okay.
and which was, I'm really against of the casteism, because definitely it is really making unfair for those who are capable.
Okay, so now this makes it, is it more harder to get into university for medical school?
Yeah,
Okay.
because you need a very high percentage. Like
Okay.
if you will get 90 plus, then you will get in government hospital, government colleges. Government colleges fees are very less. Like
Okay. I think that's the same way in Nigeria. Government universities are
like
more cheaper.
in 1 year, you have to pay, I think, 4,000 pesos or something.
For a year?
4,000
Wow,
pesos
in
per
the
first year.
government
Yeah,
this
yeah.
thing.
So
But it's quite difficult to get
yeah,
into, right?
and if you will go to private, then in private it will be like 500,000 rupees. So it will
That's
be
how much
like
in peso?
in peso around 400,000 or
Wow,
something like
that's a like that's a huge difference.
that.
So
Yeah, 350,000 something. Like
okay,
that.
so would you say that the reason why we have a lot of Indian medical students in the Philippines is because of it's more kind
the
of
passing rate is
it's
very
high.
and among the demand the seats are limited.
Oh,
That's
okay.
why
Okay.
those who will be like 90 above for general categories, there will be no worries, but if below 80 or something,
It's very
then
difficult.
it is difficult for the general category. But for the lower caste like SC, ST and OBC, for them it will be very easy to get.
So basically, getting into Indian medical schools is very difficult because of the the grading system.
Yeah.
Which I think it's also the same thing with my country to get into to medical school in Nigeria. It's so difficult. Okay, so this brings me to my next question. I know, like probably because you're from India, you should like have known how the medical system in India works. Are there differences between the medical school in India and the medical school here in the Philippines?
Actually, the system here, we have a MCQ type system in examination.
Okay.
And
So MCQ means
yeah.
multiple choice questions.
Yeah.
Okay.
Here in Philippines, we can see that every week there is an exam.
Yeah.
Right? In India, we don't have every week. It will be by 2 months. It will be by month, and it will be not MCQ. It will be essay
Theory.
writing. Yeah,
Oh my
essay
god. I
writing.
think you guys okay, so I was also making some research online and I observed that in India what you guys offer is the MBBS.
Yeah.
While in Philippines it's MD.
MD,
So
yeah.
can you explain the difference between the two for people who don't really know what it means?
Actually, MBBS is a 5.5 year course, and
Yeah.
it will be with the similar subjects, but there is a forensic science subject is in India, but here we don't have a forensic science. So there are minor changes in the subjects wise, but in major subjects there is no
It's the
difference.
same, yeah.
It is same. You have to study 4.5 year and 1 year
Internship.
clerkship, which
And I think
we can
in
say
Nigeria
clerkship, yeah.
in Nigeria also it's also MBBS, but ours is for 6 years. But the MD, like in comparing it, you see that the MD here, that's Doctor of Medicine in Philippines, is 4 years, right? But the 4 years actually, it's not just. It doesn't mean you just spend 4 years. You should have done the pre-med, the type he did, the pre-med he
Yes.
did. So that's basically the difference. Okay, so next question I would like to ask you, right? In your own opinion, between these two countries, India and studying in Philippines, do you think that one country is better than the other, or do you think they are equally the same?
Actually,
I mean, in the quality of education.
for quality of education, actually, we cannot say something regarding comparing two countries in medical knowledge, because we are using same books and same content.
Okay, so it's the same
So,
textbooks?
Yeah.
Oh, okay.
Actually, even we are using Indian textbook, the content of the book will not change. It will be like, if you will compare two books, it will be almost similar.
For example, let's say in pathology, it will be the same
of course, it
topics.
will be, yeah.
Okay.
So there will be no changes in between two countries or something. But maybe the teaching system, like teaching method, will be different from India. In India, doctors will teach, then afterwards, of course, definitely, that doctors have a consultant will teach, resident will be followed, so they will follow up with the student, and if you have a concern, if student have a concern, then they will contact to the resident, so they will be available to
So
help.
you're saying that in your own opinion, you don't see any difference between the two?
Actually, I don't really feel any difference. Yeah, of course, if you will be in India, then if you don't understand any topic, then you can make a conversation with doctor in your own language. So it will make easier to understand, which is different view, but knowledge-wise, both are same.
Okay.
Only understanding it will make by just conversation
In your
and
own
the
language.
language barrier.
Yeah. Okay. So next, what do you think? What do you love basically about studying in the Philippines?
For studying in Philippines, I
Yeah.
can say that I can meet to different countries people. So, for example, my classmates are Nigerian,
Yeah.
then of course from South Africa part, Ghana, and also from Nepal,
Yeah.
Thailand.
Thailand?
So, yeah.
Wow.
Actually, Thailand students currently not um, approved yet from their country, so we cannot see any Thailand student right now. But maybe soon they will. But they are in BS Bio.
Oh, okay. For
So
BS
They,
Bio.
they are doing BS Bio,
Okay.
but
So
medicine it's not allowed for them for now.
so you love that you have like different
Yeah,
students from
definitely.
different
Yeah.
parts of the country,
Even
of the world rather.
Indians, many we meet to different part of India, like
Yeah.
all Indian student. From that all Indian student, we can find that different kind of
Kinds
the
of
state
Indian.
Indian.
Okay, so that's one thing you love. You love that you have different people from different parts of the world. What
Yeah.
other thing do you think you like about studying here?
For studying here, definitely what we call doctors are really helping us, so it is really helpful for us, and we can explore with teaching system of the different country,
Yeah.
and also there will be opportunity to go other countries also, not limited to only India. If I want to go to different like another country for practice, then I can go there also after giving board examination. So of course it will make me prepare to go
Better.
further.
Yeah. And how about the challenges? Because it's something I love to ask people, like, because we all come from different parts of the world. I have interviewed people from different parts of Africa and also an American Filipino. And I just want to know from you, as an Indian student, what are the challenges you faced so far studying here in the Philippines?
Actually, we can say.
Let's be honest, too.
Yeah, to be honest, there were a lot of challenges during. I came here in Philippines in 2012.
Wow.
Yeah.
Wow,
So,
that's a long time.
then
That's like
it's
nine,
almost
9 years, 8 years,
eight
9.
and
9, it's actually
yeah,
9.
It's actually 9 years.
Okay.
And I really passed through a lot of challenges, like for example, the conflict of the school. So I dropped for 1.5 years. Then I enrolled in another school.
That's
then I
1.5
came back.
year. What were you in Philippines?
Yeah.
Okay.
Actually, 6 months I went back, but for my visa concern, I have to
Come back. Okay.
And in Philippines, there is different visa system. Their rule is different. In Australia or in USA, if you will go, they will give you 5 years visa, or it will be in like pack.
Yeah.
Like, you don't need to renew it.
Yeah. Do you
But
guys renew visa every year too?
during 2012 to I think 2014, we have to renew every 6 months, and
What?
the file was not staying here. Like there
Student
was
visa, renewing student visa every 6
every
months.
6 months.
Oh my God, it was even worse.
Yeah, and the thing is, there was no Cebu immigration, so file was going
Wow.
to Manila.
So if you want to renew, you have to go to Manila.
No, there is officer here
Okay,
in school
okay.
will bring all documents there. But
Okay.
the thing is, they will approve your visa and you will get visa in 2 months. When you will see your passport, you have to go give it to back for the renewal.
Wow. So let's say you renew your visa, you get it 2 months later. So that means you just have barely 4 months to use the visa, and it expires again like that.
It will expire after 4 months. So their rule is you have to apply 2 month advance of the expiration.
I can understand. So what he's saying is that for them during that time, so the visa is just valid for 6 months.
Yeah.
So you need to renew it 2 months before it expires. And if you send it for renewal, by the time you get it back, it's almost expiring again.
Yeah.
Oh.
So,
but I think it's a lot better now. At least our visa, it's 1 year.
And afterwards, they literally change for 1 year. Then they transfer Cebu immigration here. Like they founded Cebu immigration here. So
I think it's a lot easier right now. But what I'm saying is, I just feel like renewing visa every year, it's actually a challenge.
It's still challenging because
but it's a lot better compared to to those
even
times.
For ACR, it is open fact for all of us that we are paying for the ACR and we are not getting ACR on time. And because of that, if students have to travel back to their country, then we have to apply for the waiver. But here
so you
there
guys, ACR is actually a card, right? It's like a card basically for international students. So as a foreign student, you need to have this card. But the thing is that by the time you get this card, it's almost expiring, and without this card, you can't literally travel outside Philippines.
So, and there is one more update right now that you don't need any ACR waiver form now. So if you have a ACRI card receipt, then you can show that receipt and then you can travel. So right now we don't have to apply for the waiver. Before we have to apply for the waiver if you don't have ACR.
Okay.
So it will cost, I think, 1,500 more.
Okay. Is there any other challenge you faced?
Mainly foreign students are really struggling because for Filipinos, of course, they can speak their language and they can interact with the patient even. But for foreign students, we are speaking English, and people here in Philippines, they can speak English, but not all not all patients can speak English. So it will be challenging for the foreign student even in clerkship. But that is okay because your group mates will be Filipinos.
That's if you're lucky enough to get good group mates, right?
Definitely. Of course, they will make the school will provide the groups with the combined with the Filipinos.
All right, thank you guys so much for watching, and I'm actually going to make a part 2 of this video. If this is something you would like to watch, make sure to subscribe to my channel. So in the next video, we'll be discussing how he was able to handle medical school and his advice to future Indian medical students intending to study medicine in the Philippines. So if this is something you would like to watch, make sure to subscribe to my channel. I will see you in my next video. Bye.